Hi, everyone. Welcome to the Hormone Health Bootcamp. And today we are chatting with Dr. Mache about urgency. Hi, Dr. Mache.
How are you doing, Reena? We're going to talk about bladder concepts in general, sensitive bladders, things that are just annoying, things that are challenging, things that are causing you difficulty because it's not easy when you know where every bathroom is between your house and the North Pole. I mean, you've got to have the opportunity to deal with some of this.
Or when you feel like you have to run, but there's really not that much coming out, and you go, why? Why did I feel like I needed to run when there's really not that much? I went and saw the menopause musical last night. It was so funny. If it comes to your town, people, go watch it. It's so funny. They picked the greatest songs from the 70s and 80s, and they've reworded them. And one of the themes was the urgency with the women having to run to the bathroom 4 times a night, as well as during the day. So, Dr. Mache, the first question is why? Why does our body go from sort of a normal performance body to the sense of heightened urgency?
Well, let me just say the bladder is really like a balloon, if you think of it like that. And it's got an outlet that is made of muscles. And this balloon has to stay at a certain level of alignment because you have the bladder itself, and then you've got the urethra, the little tube that comes out. And so what happens is a couple of things. If the angle between the bladder and the urethra gets to be straight, it's like a funnel. And so that causes a sort of what's called a stress incontinence. That's when you cough or you sneeze, you have a problem like that, urine comes out. The other is if the bladder actually gets inflamed or irritated, or it has an infection inside of it, in which case it causes the sense of being full and you have to go. So really, the cause depends on what's going on in your bladder. But it's this awareness of needing to go, the urgency that's a problem. I mean, the first line is always make sure you don't have a bladder infection, because that is the most common thing.
And we do see that, right? We do see an increase in bladder infections. Why is that?
Well, it can be for a variety of reasons. It can be, number one, if people are, when they get sexually active, and particularly if they haven't been in a while, it can be a little inflamed to the urethra, that little tube that comes out, and bacteria can go back in. It can be from not getting enough fluid, as simple as that, not flushing out the bladder all the time, and there's residual. It can be from the bladder not emptying completely, and bacteria stay in the bladder, and you never get rid of it, so it becomes like an area that breeds bacteria. There's a lot of reasons that this can be caused.
Right. But those are not necessarily related to hormones, right? What is it about this change in hormones that's
the lining changes inside the bladder epithelial. The cells that line the bladder change towards the end of menopause, as your balance gets out and you start getting lower in estrogen. The actual inside lining, the protective cells and how they come together to form a protective coating inside the bladder, that can spread apart a little bit and leave space for bacteria to get in, make it more vulnerable. And then the other is, of course, particularly, and this is a problem in women who are older, the tissues around the labia, the lips of the vagina and so forth, can actually start to shrink and draw in a little bit. They can leave the urethra starts to get exposed like that. Okay. And that little tip that sticks out when you wear your underwear, or when you have bacteria that just from sweating and perspiration, just the things that happen in life, that is another reason that urethra sticks out. So there are a lot of reasons for this.
Okay. And it's normal. So as your hormones change, I think the one thing that we want to share with our bootcamp.
Well, let me say, not exactly normal. It's normal that it happens, but it's not normal to have continuing bladder sensitivity. You can fix it. That's what I'm saying.
And how do you fix it?
Again, it depends on the cause.
Okay, let's go one by one.
If it's infectious, you have to be able to treat that. And if it's a recurring infection, then you have to, go on something in a more long-term way. If it's because the tissues on the outside of the urethra have thinned because of aging, then you can apply local hormones to that, and you can make it, the tissue can actually regenerate again so that it goes back and you don't have that underlying problem. If it's a problem because the bladder is not emptying completely, because the bladder has dropped a little bit as a result maybe of having kids, but it's not only women with kids. Some women have this problem who are younger, in their 30s and so forth, they have this problem. If that's the case, then sometimes very limited little procedures can be done, outpatient procedures that can lift the bladder up and can stop that residual from staying and allow it to empty. So there's a number of things. And sometimes there are medications. If your bladder has not the best nerve supply for a variety of reasons that can happen, there are medications that can help to squeeze the bladder harder so that the muscles contract, and this balloon with muscles around it can empty and let the urine all out. So there are a lot of reasons, and there are a lot of treatments.
For someone who's experiencing the urgency problem, what do you recommend?
Well, again, they should make sure that they don't have an infection, number one, and they should see their doctor. Here's the thing that's most important about sensitive bladders and things to do with your bladder. For some reason, women believe one of two things. One, that it's just part of the process and you have to deal with it. That's number one. They believe that, two, there's nothing that can be done about it. Or three, they become embarrassed because there are bigger problems in the world, including maybe problems that they had. And the average woman waits 5 to 7 years to talk about her bladder with her doctor. These are known from studies and surveys that are done. So the number one thing is that it isn't normal to have problems with your bladder. It's annoying as the devil. It is embarrassing because you have these things happening. And for women, especially if you're having intimacy and all of a sudden you have to go to the bathroom, and you do, which some women, this is not an infrequent situation, that's awful for her. It makes her feel terrible, and it can ruin a moment. So you don't have to have this. You can have it addressed by simple studies that can be done. Many of them just right in the office, and it can be fixed.
I'll share my example as well. When all the symptoms were happening. So one of my 25 symptoms was, of course, having to go to the bathroom. I'll share. I can't believe I'm going to share this very embarrassing episode. But
I'm going to listen.
My husband and I were driving into the city, and suddenly on the Bay Bridge, I had to go. And he goes, "But didn't you just leave home?" I go, "Yes, but now I need to go." And it got so bad that I forced my poor husband to get off Treasure Island. And for those of you in the Bay Area, will know where it is. For those who don't, it's basically, 3/4 the way through the bridge. There's a little thing called a Treasure Island exit. We take this exit, and of course, there's nothing there. Treasure Island doesn't have restaurants. It doesn't have homes. It used to be a military base. So we're literally hunting around. There's nobody there. We're looking for a bathroom because I couldn't wait the additional 15, 20 minutes it would have taken for us to get off the bridge onto a fast food restaurant. I was like, nope, you need to take this exit now. And if I have to go by the tree, I will go by the tree. In hindsight, it sounds funny. At that time, I was not only mortified, I was flabbergasted that my body was going crazy, because to me, again, logically didn't make any sense. But why do I need to go so badly? And of course, like I mentioned, when you go, it's not like there's a lot to go. So that's the one episode that sticks out in my mind. And we found one of those porta potties, that kind of places near a construction site to go. And I remember coming back, sitting in the car and going, geez, I need to Google this. But Dr. Mache said something very, very insightful. It never occurred to me to go talk to a doctor. Even then, my first instinct was, I gotta go Google, like, what's happening to me? This makes no sense. And so of course you Google urgency, and of course, there's all kinds of crazy stuff on the internet. long and short of it is, it completely went away. Oh, and of course, I used to wake up twice at night, which my doctor had said was completely normal as you get older. You know, yeah, it's normal. You get up in the middle of the night, it's fine. I can tell you that now that I'm completely rid of every symptom, this was one of the symptoms to go. It was one of the earlier symptoms to go. And I don't know which of the supplements I took worked. I don't know, you know, Dr. Zach Bush and I have talked about this. My personal belief is that the body heals in waves and not symptom by symptom. And so my body got to a level of strength where this was one of the symptoms that just disappeared along with like 4 other symptoms. So my recommendation is, oh, and yes, there was a naturopath who gave me a couple of things. There's some Chinese herbal things for bladder strength, which you can try if you're interested. There is some stuff for in naturopaths as well for kidney performance, by the way. So there's a belief that the kidneys, a weakness in kidneys is also linked to the weakness in bladder. And so if you can strengthen your kidneys, please talk to your naturopath or talk to a functional medicine doctor about that as well. Because I did take some of that stuff too. And again, like I said, I don't know what worked, Dr. Maish, but as of right now, I am back to a 25-year-old's bladder, and boy, am I happy about that. So,
you know, there are many ways to do this, and the main part is to talk to someone. And the thing is, there are in the traditional medicine and the allopathic world, there are people who deal with this. There are some gynecologists deal with it. There are urologists that deal with it. There's a subset of gynecologists who have had additional training. They're called urogynecologists. But the most important thing is to address it. Sometimes people have bladders that are smaller than the normal capacity. The balloon is actually not as able to expand, so it gets the sense that it's full at a smaller volume. Some people have some difficulties with some changes inside the lining of the bladder so that it becomes irritated and a little bit of urine causes it to feel that it's full. Sometimes there's inflammation of that urethra that makes you feel something down there like you have to go, but you really don't have to go. It's a whole workup that can be done though relatively quickly, usually in an office setting. And you know, years ago, 20, 25 years ago, when women had problems with their bladder, many times they ended up having a hysterectomy in order to have the bladder problem corrected. Now that still might fix it, but today it's often not the case that it's necessary because there's so many minor things that can be done. And many times there are they're not surgical at all. There are medical treatments. One of the things that's really come about in the last years is there's a new type of physical therapy where you actually go to a physical therapist or bladder therapist, and what they do is put inside the vaginal canal like a little wand. It goes inside and it has very mild electrical stimulation. It's not painful at all. And you put this inside in the setting of in the office setting first to know how to do it. And it stimulates the muscles to contract better so that they're able to squeeze down on the opening of the bladder so that the urine doesn't come out. And then you can do a lot of this at home. And there's actually things you take with you to learn how to do this. And this has changed the game for non-surgical correction of bladder problems, this physical therapy approach of the bladder per se, strengthening those muscles. There's no reason to have to endure this kind of craziness. And as I said, 5 to 7 years to talk about it means that you've suffered a very long time in silence. And you don't have to suffer in silence. You can go and just voice your concern and just have it dealt with.
Mm-hmm. I hope, you know, for all those listening into this Hormones Bootcamp video, if there's one thing that you take away from this bootcamp, it's a strong voice and the determination that you're not going to suffer with symptoms. You know, it's always that step one, right? Saying, nope, not going to take it anymore. And then step two, now who am I going to talk to about it? I will share an anecdotal information about the infections, Dr. Maish. I'm surrounding with friends who've had infections, and one has had a hysterectomy because of that. By the way, even today they're removing in order to help with a bladder infection, which frankly to me doesn't sound logical, but it is what it is. What I will share is two of my friends had an experience where uh, apparently one possibility for the higher level of infections is the change in the pH balance in the body. Because of the hormone imbalance, the body starts to become a little more acidic, and it basically becomes more attractive to the bacteria you don't want. And so whereas prior to a hormonal imbalance situation, you were able to handle external bacteria better, now your body's just more prone to catching whatever's around because your body's pH balance isn't right. And so both of them tried different things, but I remember it being more like the alkaline stuff. So doing more green juices, cranberry juice, I remember being told. And so they added a lot more nutrition to their body to strengthen the alkalinity and to keep that pH balance of their body in order to decrease the infections. I don't know if there's any scientific merit to this, but I did want to share that with our listeners.
Well, why you want your, while the body's alkalinity and acidity may be working at one level, what happens as women transition in hormonal imbalance is that the vaginal area actually gets alkaline as a not normal situation. Normally, the vagina is quite acidic. It goes at a pH of about 4.3 or somewhere in that area. And then what happens is, as hormones go away and as estrogen gets less, it becomes more alkaline. And that change in alkalinity in the vaginal tissues causes the bacteria to grow. And actually cranberry juice and these other things that are actually bringing acidity because of, a citric acid in it. So that's a very important point. And one thing I want to tell you that it may be important for you, for your mothers. My mom is 93.
Wow.
She was doing just fine until she had a situation where she moved from one place to another and she lost her tube of vaginal estrogen in that move. So what ended up happening is, remember I told you how that urethra can get to be more exposed and let bacteria in. So my mom went from being a very reasonable, well person to getting an infection that caused her to be septic and caused her to go absolutely bonkers. She got a meningitis and a encephalitis, and she just got sick and almost died from a bladder infection, because in the older population, this is a common cause of death. So I'm telling you, for your mothers, grandmothers, this is something that's very, very, very near and dear to me, and something very, very near and dear to those women who are getting up in age, where this little bit of change allows them to be exposed to bacteria that cause bladder infections and ultimately sepsis and death. And I'm telling you, it's not an uncommon cause of loss of a parent or grandparent in that age group. So please realize that, and that's something to talk about with them, with their doctors, because they aren't doing it. And the hormones put down there on the poopy-doo I will tell you, be as effective as swallowing a ton of antibiotics in terms of preventing these recurring infections in the older population. So this is something to really be aware of.
Wonderful tip, Dr. May. So as we wrap up, is there any other parting advice you would like to share?
No, only to say once again, if it's not making your life feel like it's normal and there's something not going right in terms of the urinary system, talk about it. Don't be afraid to do that. Something can be done to fix it. And if it can't be done to fix it by who you're talking with, then get a second opinion.
Thank you, Dr. May. And for the rest of you, we'll see you on the next Hormones Boot Camp video.
Take care. Bye-bye.